Hello, my name is Dr. Richard Johnston, and I'd like to talk to you about the things that you need to know before your total hip replacement. Hip replacement surgery is one of the most successful surgeries available today. Time and again, studies have shown that patients get more improvement in their quality of life from hip and knee replacement surgery than any other operation from any surgical specialty. The vast majority of patients who undergo a hip replacement can expect multiple decades of pain relief with increased function from their hip replacement. With modern designs and materials, most patients will never need to face a second replacement. There are things that you can do to help your hip replacement last as long as you. You should exercise and eat well to maintain a proper weight. You should avoid high-impact activities such as jogging and sports which require extensive running and jumping. You should avoid the extremes of motion that may risk a dislocation. After your replacement, you should always take antibiotics when you have any dental work, especially cleaning. If you have a colonoscopy or an endoscopy, you should also take antibiotics before those procedures. You will need to build up your nutritional status before surgery. Patients with higher levels of protein in their system have fewer infections, fewer complications, and they heal better. You will need to start at least 1 month before surgery with a program to increase your nutrition. We will give you information about a nutritional support program when you schedule your surgery. Many patients undergoing a hip replacement will require a blood transfusion. I recommend that patients have 2 units of blood available at the time of the hip replacement surgery. There are 3 choices for where the blood can come from. You can donate your own blood if you start with enough time before your surgery. Someone in your immediate family can donate blood for you if they are your type. The Red Cross or bank blood is also an option. There is a very slight risk of disease transmission with bank blood. Current data shows the risk of hepatitis or AIDS from bank blood is approximately 1 out of 500,000. Before surgery, you will need a complete checkup from your internist or family practitioner. Your physician will need to certify that your medical condition is strong enough to withstand major surgery. As part of the pre-surgical evaluation, you will have laboratory work and will likely need a chest X-ray and an EKG. Occasionally, testing will find a potential problem that may delay surgery while it is evaluated. If you have had heart surgery or have had a heart condition, you will need approval from your cardiologist prior to surgery. You will be admitted to the hospital on the same day as your surgery. You will be asked to come to the hospital several hours before your scheduled operation. During that time before your surgery, you will be checked in, have an IV started, and meet the anesthesiologist. Most patients undergoing total hip replacement at Missouri Baptist Medical Center or St. Luke's Hospital will have a general anesthetic, although spinal anesthesia is also a good option. You will need to discuss this choice with the anesthesiologist. I will keep your family informed of your progress during surgery and will meet with them immediately after surgery. Total hip replacement takes an average of 1 hour and 45 minutes to perform. It will take approximately 30 minutes before surgery for anesthesia time, prepping, positioning, and draping, as well as 10 or 15 minutes after surgery before you go to the recovery room. Following surgery, you will spend at least 2 hours in the recovery room and will then be transferred to the orthopedic floor. When you wake up, you can expect to have a special pillow that protects against dislocation between your legs, as well as pneumatic compression stockings and support stockings to help prevent blood clots. You will start physical therapy on the first day after surgery. Your therapist will first work with you on getting in and out of bed and then walking. Before you leave the hospital, Your therapist will work with you on going up and down steps and getting in and out of a car. Most patients can expect to be discharged from the hospital and go home 2 to 3 days after their surgery. Those patients who are weaker before surgery may need a short stay in rehabilitation afterward. Because of federal government rules, rehabilitation in the hospital is no longer an option for most patients, and those patients who need extra care will need to go to an extended care facility or nursing home if required. If you feel that you will need extra rehabilitation after your total joint replacement, it is best to look into this before your hospitalization. Before you leave the hospital, arrangements will have been made for home health physical therapy and nursing. A walker and bedside commode will be arranged. Your home therapist will meet with you 3 times a week, and you will do home exercises daily. Unless I have told you otherwise, you can put full weight on your operated leg. I will need to see you back in the office in 1 month after surgery, so please call ahead for an appointment. Most patients after total hip replacements will be able to move from a walker or crutches to a cane in 2 to 3 weeks. Once you are safe on a cane, you can resume driving a car. You can expect 90% of your improvement after your hip replacement by 2 months. However, it may take 6 to 9 months for you to get complete improvement. I'd like to take a few minutes to talk about some of the technical aspects of total hip replacement. And we need to start with the basics, your hip joint. The hip joint is made of 2 parts, a ball or femoral head at the top of your thigh bone or femur, and a rounded socket or acetabulum which is formed out of the pelvic bone. There are a number of conditions which can lead to total hip replacement. Osteoarthritis or degenerative joint disease is a wear and tear process. In rheumatoid arthritis, the body's own immune system attacks the joints. Post-traumatic arthritis occurs after an injury to the hip. In avascular necrosis, the blood supply to the femoral head is cut off, leading to collapse of the bone. This picture shows a total hip replacement. Here you see an X-ray of a total hip replacement. There are different types of total hip replacements. Porous ingrowth prostheses are held in by bone growing into small spaces in the back of the metal components. Some femoral components will be cemented in patients who have severe osteoporosis. A total hip replacement consists of 4 parts: an acetabular shell, which is fixed to the pelvis, a polyethylene liner, which is secured inside the shell, a femoral stem and neck, which are attached to the thigh bone, and a femoral head, which is secured to the top of the neck. The femoral component, or stem, is the part that goes into the femur or thigh bone. This is held in long-term by bone growing into small spaces in the upper part of the stem or by bone cement. Most patients will have an ingrowth type prosthesis, but some with more severe osteoporosis will require bone cement fixation. The prostheses on the left are porous ingrowth prostheses. Those on the right are cemented prostheses. You can see how the cement surrounds the prosthesis and holds it into the bone. The femoral head is a ball that is fixed on top of the femoral stem. It is usually made of cobalt chromium, a very dense, hard, and durable metal.